Most African settings, it is common to find parents advising their children against looking for marriage partners in the same clan, citing that it leads to having children with abnormalities. But as time has passed, science has kept evolving, showing that these abnormalities are a result of genetic disorders. Dr. Leo Mutesa is a geneticist, and he explains one's genetic composition.
Genetic makeup, you know, all of us, we have what we call the chromosomes. Chromosomes, those are unity of our genetic materials, which carry what we call the genes. So in total, we have 46 chromosomes, and those 46 chromosomes, they are either 46 XX if you are a female, or XY. So before you get married, so everyone is like that. But when you get married, you will be having a child, for example, who will be inheriting your chromosome. By the time the child is just inheriting the same the half of the chromosome for each parent, then the genes will be transmitted. So that is what we call genetic makeup. So once the genes are transmitted, they can be transmitted as a normal genes or abnormal genes.
Genetic testing is not something you will often hear about among people that are planning to get married or starting families, something that could be important in order to avoid spreading genetic diseases.
Because some people are scared of what they will find. If they are positive in any way, or if they have any defects, how are they going to handle it? The issue, will they still stay with their partners, or will they keep the babies? So that will affect the whole relationship or the whole entire family. The second reason is the expense. Some of these tests are expensive. So you find that you may not easily afford. However, if you've taken maybe an STD test and you're safe, so you may not you may not really want to take the other test if it's not cheap. So getting the money for that, you're preparing to have a new kid, all those expenses are the ones that really interfere with that. That's
some of them be like, I don't think my partner has this, or I have this. So most of the hindrances is people being like, I won't use ignorant, but they don't think there's that in Africa, or there's that can get it from the partner. Really, they trust themselves, which I don't think is nice.
Most genetic disorders happen when someone has two bad copies of a gene from each parent. A biologically compatible couple will have normal offspring, whereas an incompatible couple will have children that are vulnerable to diseases affecting genes.
Is a condition where we see the chromosomes. As I told you, the chromosomes, they carry the genes. Our genes are packaged in an entity called the DNA. And then, if there is any chromosomal abnormality within a family, so then that can be also inherited over generation. So then people who know that they have those conditions in the family, they need to get a test before they get married, because they know my parents, for example, or my cousin, or someone, or my grandparent has been maybe suffering from the same disease, so I need just to test.
Diseases like sickle cell, albinism, vitiligo, asthma, spina bifida, among others, are known to be hereditary diseases. Dr. Mutesa explains how genetic counseling can be used to address some conditions such as Down syndrome, which is less likely to reoccur because it's a genetic accident.
We used to see cases of Down syndrome. Down syndrome is a chromosome abnormality, which most of the time is caused by accident. It's an accident during the fertilization, where the chromosomes, instead of the chromosomes that I talked about, instead of bringing the equal number of chromosomes that are required for individual to be normal, there's an extra chromosome. That extra chromosome is 21. That chromosome 21, when it is present, then a child is born with Down syndrome. And then we used just to see those parents coming back. Most of them, some of them, they are young. We are not planning for next pregnancy. should I be really at high risk to get this? After testing, after doing our cytogenetic analysis, and then we see that was the cause of that Down syndrome was just an accident. Then you can really ensure that there's no high risk to get again that, because that was an accident.
Genetic diseases screening services are not yet fully implemented here in Rwanda, so most screenings are done depending on case per case. Dependent on which disorder one is screening for, it can go from $300 to $2,000 US. According to the World Health Organization, genetic disorders and congenital abnormalities occur in about 2% to 5% of all live births, and account for up to 30% of pediatric hospital admissions and cause about 50% of childhood deaths in industrialized countries.